So now there's more than one ligament in the ankle on both sides. So we're going to do the talar tilt. You can do it on the lateral side and you can do it on the other side. So basically what you're doing is you're holding just below the lateral malleolus and then stressing the ligament. And then you can put a little bit more stress this way to anterior talifib, calcaneal fib, and then posterior talifib. And then you come over on the other side and do it for the deltoid. So again, you're close, you're basically putting your fingers or your thumbs over the actual ligament itself. And then you're forcing it into, in this case, eversion. And then over here you're forcing it into the inversion. Let's see if I can get that to work here. So you're stressing that ligament there and looking for laxity. I mean, that one you could just practice while you're sitting there yourself. It's easy. You can do it on the medial side. It's a little harder to do it on the lateral side, but we'll practice that in a little bit.
So do the thumbs underneath the malleolus, does that serve a purpose? Are you trying to feel something with your thumbs? Or is that just there as a fulcrum?
Both. What bone are you putting contact on? Let's say if we're talking about the, well, in either case, medial or lateral. Yeah, talus. So you're using that as a fulcrum to press on, but then you're also feeling for laxity. And then, of course, you're going to do compare to both sides, right? For one side compare to the other. That one I would probably have positive on my right medial. So in this case, it's talking about calcaneofibular. So actually the diagnosis you could add, there could be different diagnoses. Depends if you're doing it on the medial side. Because here we've got excessive abduction is going to be deltoid, and then calcaneofibular on inversion. But again, you could do anterior talofibular depending on which direction you're forcing. Right? You know, like I say, there's just a straightforward basic way to do these tests, then there's other variations depending on how you position it. So as long as you understand the anatomy and know what you're doing, you're going to be able to check which ligaments. Okay, so before I do this Thompson's test, we're going to have somebody demonstrate that.
And it's checking for Achilles tendon rupture, and it's really, really easy. You just basically squeeze the calf here, and it should do that. If it doesn't, if the foot doesn't move, then that means that the tendon's not working, so it's ruptured or hurt in some way.
So basically this is for contractile tissue, and the thing is though, is if you do this and his ankle moves, that doesn't mean for sure that there's not a rupture. If you see that it doesn't move, you know for sure that there is a rupture, but there can still be other fascia or different things that may be connected that could still plantarflex the foot. So if it moves, you can't completely 100% rule out that there's not an Achilles tendon rupture. On posterior to the medial malleolus. And then you're looking for tingling or paresthesia down into the toes and feet. So then this one is going to be, on the lateral side, it's going to be the deep peroneal, and then on the medial side is going to be posterior tibial. And then Morton's test, you're checking for Morton's neuroma. Like I said, it's like where you're shaking hands with the foot. Okay, and you're squeezing, and then you're looking for some reproduction of tingling, numbness, pain between the toes. And then I guess it's out of order, but here's the Kliger's test. So you're looking for a deltoid on this side. So we're basically stressing the foot out in that direction here. So you're grabbing like this and then pulling out. So you're stretching the ligaments on the medial side of the foot. one sign. Basically what you're doing is dorsiflexing the foot. So you can also palpate the calf muscles. So you're looking for pain.
Would that disenlarge a thrombosis? I mean, would you want to be doing that if you suspect one?
You'd probably want to be careful. I mean, if they have, and let's see if I can pull up that other one I was talking about. So bear with me, I gotta go to the end of the thing here. So what we're going to do at this point is just practice these tests, and if you want to grab tables you can. If you want to just put two chairs together, you'll probably be able to do it that way. If you want to use this one here. Okay, so here, I couldn't get this slide up before, so blood clot in the leg, basically it's prolonged sitting, bed rest, immobilization, certain types of surgery, pregnancy, medications like estrogen, birth control. So yeah, if you do see something like that, are you going to go in there and palpate? No, I don't think so. Okay, so you're looking for a change in color. It's usually going to get red and swollen. Palpation of the affected leg, it's usually going to get hot. Because here you got inflammation going on, so redness, swelling. What happens is you have the clot in here, breaks loose, goes up in through the heart into the lungs, blocks the blood into the lungs. Bad news.
How does that happen in a baby? Vein thrombosis?
It's not in the kid, it's in the mother.
Oh, it looked like a baby's legs.
No, I don't think so.
It did.
Yeah.
So here's another rare condition that you find in the lower leg. It's Groucho Marx syndrome. So here's in the examination, you look for deformities, calluses, things like that, plantar warts, bunions. So here's the clawtoe, where you're having extension at the metacarpophalangeal joint, metatarsal phalangeal, I mean, and then flexion at the PIP and flexion at the DIP. Here you've got extension at the DIP, which is the hammer toes.
What is it about shiny skin and hair loss?
Shiny skin, like we talked about with the compartment syndrome, where the
Right,
skin is
so-
taut, so it'll feel shiny and glossy because it's stretched tight.
Right.
And then hair loss is just something that you'd want to notice. When you're doing inspection, you just
Like
look
a
at
patch-
everything.
Like a patch, like.
Yeah, it could be a patch, or if you're having decreased circulation or something, maybe you're going to have hair if you compare one side to the other. And then here, what's this here? Okay, bunion, or it's also called what?
Bunion. Oh.
I know. You want to do the technical term. When the big toe, you also call it the hallux. So which would this be, valgus or varus? Valgus, because the distal part's moving away from the midline. So bunions is called hallux valgus. And then there we talked about observation, looking at their stance and their weight bearing and gait. And then that's not a good thing right there. Okay, so we'll just go through and practice the different